Hi, this is Randy Wykoff, the Dean of the College of Public Health at East Tennessee State University, and I'm pleased to provide this week's update on the COVID-19 pandemic for the week ending April 15th, 2021. This is the day of giving for East Tennessee State University, and I'd like to take a moment to thank all of you who have supported the College of Public Health and supported this important university over the years. This week, I'm going to pose two questions and provide one new resource. As always, I'll talk about how the pandemic is progressing globally in the United States and in our region. I'll talk a little bit about what's going on with the J&J vaccine. And then I'm going to provide a new herd immunity thermometer, which I hope will make things easier for us in the future. In terms of the progression, almost 3 million deaths worldwide, 2.9% increase in the last week. That's quite worrisome because it's the greatest increase we've seen since the beginning of March, and that worries me quite a bit. 84,000 deaths around the world last week, 8 deaths every minute. If you look at the daily death count from, you can see the spike back in March and April and so on. What really worries me is this last couple of weeks clearly going back up worldwide. And what's pretty disturbing is that the pattern that you see in different countries is quite different. So here's the pattern for the 6 countries that report the most cases worldwide. And you see very different patterns. In the US, you see it coming down, but not getting down to zero. Whereas in the United Kingdom, it's coming down very low. On the other hand, you've got a country like France, which seems to be leveling off. Russia, which is coming down, but not particularly quickly. And then India and Brazil, both of which are going up. And perhaps the most frightening picture is the one we're seeing in the 7th, the country that has the 7th most number of cases, and that's Turkey. And you can see these very sawtooth type pattern. In terms of deaths per million, that tells you how bad a disease is in a particular country. The US is still in the top 10. If you compare April 15th with October, you can see that just in those last few months, the numbers continue to go up, with the US over 2.5 times increase since October. Biggest message we've got to get across is that this is not over. In terms of the US, 578,000 deaths, about a 1% week-to-week increase. So it's good that it's slowing down. In fact, this 0.9 is the lowest that we've seen since the pandemic began. But even with that, 6,000 deaths last week, and that's about 1 death every 2 minutes. So while it's slowing down in the US, it hasn't stopped. If you look at the pattern, as I mentioned before, it has been coming down, but it hasn't come down to zero, and it appears to be sort of leveling off about where it was in September and October in terms of the daily number of deaths. So we have to keep an eye on that. In terms of where the pandemic has been, August, September, October, November, December, January, February, March, April, a progressive pandemic, especially hitting us in the middle part of the country, in the north, central, and the southeast particularly. In terms of our region, for the states in our region, obviously the number of deaths are different because different population, but the deaths per million is starting to get pretty close to each other. You'll remember for a long time, South Carolina and Tennessee had about 50% more deaths per million than the states around us. And we still have more, but it's becoming closer. In terms of the week-to-week change, I'm glad that we're seeing about the same rate of growth in all of these states as we're seeing nationally. And nationally, Tennessee is pretty close to where the national average is. For South Carolina is worse. The other states are not quite as bad. In terms of our immediate region, the Ballot Health Service area, almost 2,000 deaths since we started keeping track, about a 1% increase in the past week, about where the U.S. is overall. But that's still 16 deaths last week, which is 2 deaths every day. And in terms of the hospitalizations, you'll recall that we were following this from August through September. It was pretty level at about 100, then it shot up, came back down. Now the last couple of weeks has been going up. This week may be down slightly over last week. We'll keep our eye on it. It's not unusual to see this sort of go up and down. So let's look at a multi-week pattern. But in terms of the pandemic, globally in the U.S. and in our region. Globally, it appears to be picking up speeds, picking up steam. In the U.S., it seems to be slowing down as it is in our region. Again, I encourage people not to be overly optimistic, because if it's growing in other places, it still is out there and it can get back to us. One of the issues that we've been banking on is vaccine availability. So you all have seen the news on something going on with the J&J Janssen vaccine. On April 13th, the CDC and FDA recommended a pause in the use of this one particular COVID vaccine. This does not apply to the Pfizer or the Moderna vaccine, but the J&J Janssen vaccine. Of about 7 million doses given, there have been 6 reported cases of a cerebral venous sinus thrombosis among women 18 to 48, about 1 to 2 weeks after vaccination. Cerebral venous sinus thrombosis is a rare type of blood clot that forms in the venous sinuses in the brain, between the tough outer layer between the brain and the skull. It exists without the COVID vaccine. About 5,000 people a year, making up less than 1% of all strokes, more common in women and men. Fortunately, most people recover. This is just a cross-section of the skull. There's the brain. There's the skull, the bony skull. Here's the brain down here. There's this thick material called the dura mater, and these vessels that lie in between. And they transcend, they go around the brain. And you can imagine that having a clot or a bleed there can have a significant impact. So what do you do if you've received the J&J vaccine? According to the CDC, if you've received it more than 3 weeks ago, the risk of developing a clot is probably very low. If you've received it in the last 2 weeks, they ask you to contact your healthcare provider immediately if you have any of these symptoms. Now, some people have said, well, if it's occurring in less than 1 in a million doses, why stop using the vaccine? And unfortunately, this has led to a number of conspiracy theories. It makes a lot of sense. While 1 in a million doesn't sound like a lot, there are a couple of reasons why it makes sense. One is this could be an early sign of a problem that's just started, right? And any problem, this blue line represents a problem, you could be early on. And so you want to make sure that this isn't something that's increasing. I'm not saying this is what's happening with the J&J vaccine. I don't believe it is. I'm simply giving you reasons why it makes sense for the FDA and CDC to ask that the vaccine not be used for some period of time while they look at the data. Second reason, it could be the sign of a bigger problem. Maybe we're just seeing clotting in the brain, but maybe there's other types of blood problems, and so they want to check that out. And finally, it's possible, though not likely, that there's some complication with a particular badge or a small number of badges. I'm not saying that any of those are the factors that happen, but what I'm saying is it does make sense, even with something that appears to be so rare as 1 in a million, to take a look at it, take a pause. This doesn't mean that vaccines aren't safe. It doesn't mean that vaccines aren't effective. It doesn't mean that we shouldn't keep giving vaccines. We will know more when the CDC and FDA have looked at all the data. And over the last couple of weeks, we've talked about herd immunity. I'm not going to go into detail other than to give you an update. In Tennessee right now, 19.7% of people are fully vaccinated and 11.8% have had a known natural infection. If you combine those numbers, it estimates that about 29% of people in our state are probably immune at this point. Now, I call that a low estimate because we know that for every person who knows they've had COVID, there are many that don't know it. And also, there are a number of folks who have been partially vaccinated. So if we take these two numbers and we assume that the chance of being vaccinated is equal whether you've had the infection or not, that would give us a high estimate of about 65% immunity in our state. So we're probably somewhere between 29 and 65%, with herd immunity probably requiring about 80%. So we're moving in the right direction, but we're not there yet. There's a great deal more information about COVID-19 on the College of Public Health website. If you know anyone who'd like to be added to this mailing list, please let us know. We are always adding people every week. We're happy to add anyone who'd like to receive this directly. I'd like to thank Melissa White for helping to collate data and Dara Young for editing, producing, and posting this video. And as always, I'd like to thank you for viewing it. And it's really important to me that you ask any questions that you have. If you question anything that I've said, or there's some topic that has come up related to COVID that you're not sure of, please send me an email. I'd be happy to try to answer it. Often I'll send an email back to you, but sometimes I'll incorporate it into the weekly update. So thank you very much. Again, thanks all of you who've supported the College of Public Health in the past and will do so in the future. But for all of you, please be well. Thank you very much.